That's the order.
Boris Johnson's visit to AstraZeneca's Macclesfield plant is clearly a confident shot in the arm for the vaccine producer. More concerns have been raised in Europe over its possible link to blood clots, but the Prime Minister insisting again that this vaccine is safe.
On the AstraZeneca, the Oxford-AstraZeneca vaccine, I think that the best thing people should do is look at what the MHRA say, our independent regulator. That's why we have them. That's why they're independent. And their advice to people is to keep going out there, get your jab, get your second jab. Very, very important.
But despite the Prime Minister's insistence on the vaccine's safety, there will be more doubt after Oxford University announced it is pausing a small clinical trial of the vaccine in children. In a statement, it said, "We await additional information from the MHRA on its review of rare cases of thrombosis, thrombocytopenia that have been reported in adults before giving any further vaccinations in the trial." The decision is bound to raise further concerns, but I was told it does not mean the vaccine is not safe to use.
It's clear that clotting disorders are a common side effect or a common consequence of COVID-19 disease, much commoner with the disease than could possibly be the case with the numbers we're seeing due to the vaccine. If you want to avoid getting a clotting disorder, you don't want to get COVID-19, you're much better off getting the vaccine. And you're much better off getting it sooner rather than later.
The doubts over the Oxford vaccine's safety are not widespread. It is still seen as a way for some normality to return to our pandemic-limited lives.
I just want to get back to normal, so if it's safe to take, I'm happy to have it and, get back to normal.
I just want the vaccine and I don't really care which one I get, to be honest. I had to get happy to get any of them, really.
And it feels like it would just slow it down to reduce it because of a rather small number of cases.
So we need to get back to normal, and the vaccine's going to help that happen.
We've been warned that the vaccine rollout might be lumpy at times. It is certainly slowing down right now. You can see here the number of first doses administered through March comes down significantly each week. Government advisers now predict we will only be able to administer 2.7 million doses per week until the end of July. This figure is significantly less than previous estimates, and it means there is little surplus for first doses after second doses have been administered. But the slowdown has not dented the government's confidence about meeting its ambitious vaccination targets that will eventually bring us out of lockdown. Ashish Joshi, Sky News.